Okay, so first I would gather my supplies. I have my needle and syringe, and I have my order for Phenergan. So first I would just verbalize that I would check the administration order and compare it to the MAR, but we don't have it at this time. Now I'm going to get my supplies ready. First I would do hand hygiene. Now I'm going to get my supplies ready. And first we're doing an intramuscular injection. So for intramuscular injection, I would use a 21 gauge to 25 gauge. So I'm using a 23 gauge right now. I would use on the vastus lateralis a 5/8 inch or a 1 1/4 inch. For the deltoid, 5/8 inch to 1 1/2 inch. And for the ventral gluteal, I would use a 1 1/2 inch. So first I would have my needle ready. I'm going to just top off of this. And since it's 25 milligrams, I'm going to pull up 1 milligram of air and put it into right in here. Put over. And pull up 1 milliliter of Phenergan. Okay. So there's my 1 milliliter, no bubbles. And I'm just gonna waste the Phenergan because I'm sticking air into the models. Put it back in here. Okay. So for a do the deltoid first. Have my syringe ready. Okay. So I'm just going to pull up 1 milliliter of air to inject into the model. So I would make sure not to touch get anything sterile, or make sure this stays sterile. I'm going to or alcohol swab. I would also label the syringe from my Phenergan, but we don't have tape at this time, but I would just like to note that I would label the syringe with the date and what I'm using and the milligram. So first, I'm going to place my syringe back in this so I can just have it here. Okay. I'm going to, for the deltoid, you would palpate the acromion process and put the 5th finger along the acromion process, and then the other hand above the mid-axillary line. So I would inject in this area here. So I'm first going to alcohol swab model. Okay, and that's what I'll be injecting. So that. So I'm going to get my syringe. First I'm going to take my top off here. Okay. Pull apart. I'm going to aspirate. There's no blood return. So now I can hold in, take out, and gauze. So that is for the deltoid. I'm gonna sweep this back in here. Okay, now we're going to move on to the ventral gluteus, and vastus lateralis. Okay, I'm just gonna put my syringe back in here just so it stays sterile for now. Okay, so gluteal, I would do the palm of your hand over the greater trochanter, and the right hand for the patient's left hip. And since this is the right hip, I've used my left hand. Point the index fingers towards the anterior sacroiliac spine, middle finger dorsally along the iliac crest, towards or form a V-shaped triangle, and thumb towards the patient's groin. I'm just going to palpate to make sure I'm not going to hit any bone. I'm going to use my alcohol swab. since that's where I'm going to be sticking. Since there was no bone, my syringe ready. The top off. Okay, I'm going to let me pull a milliliter of air, and then I would stick. I would aspirate. Okay, now hold. Inject. Back and out. And then I would gauze it or put pressure on it. Okay, I'm going to cap my needle back. Just swoop it in. Okay, lay that there for my other sections. Okay, for the vastus lateralis, I'm going to put one hand above the lateral femoral condyle and one beneath the greater trochanter of the femur. I'm going to then divide it into thirds horizontally and vertically and insert into the outer middle third. So I'm going to be injecting into this area here. I'm going to just swab that. Go to Z-Track, track my hand. Going to get my syringe. Let me just pull some 1 milliliter. So after I've Z-tracked, I'm going to keep my alcohol swab in my hand. I'm then going to put those fingers to stick. I'm going to hold, aspirate, no blood return, push in, pull out, and apply pressure. Okay, now I'm going to move on to a subcutaneous injection. For subcutaneous, you would use a 25 gauge to 30 gauge needle, and for the needle length, you'd use 3/8 to 1 inch. So we're going to do the abdomen and the arm. So for abdomen, arm, you want to, let me get my supplies ready here. Swab. We are not going to use an alcohol swab on this model, but I would just like to verbalize that I would use it. I'm going to, for subcutaneous, you will pinch 1 inch, and then you will swab the area. My syringe ready here. And then I'm going to inject into the model at a 90-degree angle. I would aspirate. Okay. And then I would hold, push in, out, and apply pressure. Okay. Let's see, and I'm going to cap my syringe over here. And that would be for the arm and for the abdomen.